Hi, my name is Karen Hauer. I'm the Associate Dean for Assessment. I'm here today to tell you about outcomes-based assessment in the UCSF Bridges curriculum. Outcomes-based assessment is one of the 7 core educator skills for faculty in the Bridges curriculum. The objectives of this module are to enable you to articulate the vision for student assessment in the Bridges curriculum, to be able to define key terms for student assessment, and to describe the key components of student assessment in the Bridges curriculum. What is outcomes-based assessment? This is assessment that is focused on predefined outcomes that students are expected to achieve within a curriculum. This is to be distinguished from a curriculum that focuses on what is taught. With outcomes-based assessment, we're more interested in what students learn at the end of a course or clerkship. This is a key feature of competency-based education. Outcomes-based assessment is in line with the change towards a focus on competencies, which is occurring both nationally and internationally across the continuum of medical education. In this era of greater public accountability, medical curricula must ensure that all graduates are competent in all essential domains. In the past, medical education has focused more on the process or what is taught rather than what is learned. Whereas traditional medical education has emphasized medical knowledge acquisition, competency-based education emphasizes knowledge as well as abilities. Competency-based medical education is time-independent, meaning that different learners may need different amounts of time to achieve the same learning outcomes, and that is to be expected. In that way, competency-based medical education is learner-centered, flexible, based on each learner's needs. Competencies encompass both knowledge and skills, and in that way are very relevant to learning in the workplace, like the clinical environment. So what's different with assessment in the Bridges curriculum? In the Bridges curriculum, we've designed a comprehensive program of assessment. Assessment is centralized so that the school has an overall understanding of what students are learning within each piece of the curriculum. Course and clerkship directors are working closely with educators in the School of Medicine to design this program of assessment. This will ensure that all graduates acquire the unique knowledge, skills, and attitudes that characterize the Bridges physician. The program of assessment is designed to promote each student's individual path toward competence, and we are using the framework of outcomes-based assessment. To understand assessment in the Bridges curriculum, let's start by defining some key terms. A competency is an observable ability of a health professional that integrates knowledge, skills, values, and attitudes. An example would be interpersonal and communication skills competency. A competent physician, student, or resident possesses the required abilities in all domains in a certain context at a defined stage of medical education or practice. Taken together, competence is more than just the knowledge, skills, and attitudes that a learner has achieved. Competence entails applying these abilities in the clinical environment to achieve optimal results, not just on tests, not just in practice environments, but in the actual clinical care setting. At UCSF, we are also using entrustable professional activities as part of our assessment program. These are abbreviated EPAs. EPAs represent an approach to assessment that starts by defining key physician tasks. So rather than breaking down patient care, communication, or medical knowledge competencies, an EPA starts with a task that a physician must do, like discharge a patient from the hospital or deliver a baby. EPAs require specific knowledge and skills acquired through training. They are observable and measurable, so you would be able to watch your learner performing an EPA. EPAs don't replace the competencies, but rather they reflect multiple competencies. An assessor, a teacher, would rate a learner's performance of an EPA by determining the level of trust that that supervisor has in the trainee, how much supervision or how much independence they feel that trainee should have to perform this task in the future. Let's look at how competencies and EPAs work together. Competencies describe the person, the knowledge, skills, attitudes, or values that that learner brings. Examples of competencies include content expertise, collaboration ability, communication, patient management, or professionalism. EPAs describe the work that that learner can do. EPAs are essential tasks of a professional practice. Examples listed here include admit a patient, perform an appendectomy, leading a family meeting around serious illness, or managing a ventilated patient. We will be using both competencies and EPAs with our medical students. Another definition is milestones. Milestones are typically defined for competencies. The milestones define different levels at which we expect students to perform as they develop through the stages of their training. Students often ask which parts of their assessment count toward their grade. This brings up the issue of formative or summative assessment. Formative assessment is assessment for learning, assessment that provides feedback to the learner to guide next steps in their learning. Summative assessment is assessment of learning. This information is used to form a judgment of what has been learned after a course of study, to make a decision about whether a learner will pass a course or whether that learner is ready to advance to the next level of training. Here are the key distinctions between formative and summative assessment. Formative assessment represents assessment for learning. Students will experience this as low stakes and hopefully helpful because it generates feedback that can help guide their next steps or learning planning about where they want to go in their development. In contrast, summative assessment, or assessment of learning, is high stakes. This typically generates scores or grades and informs decision-making at the level of the program about whether that learner is ready for promotion. A program of assessment puts all that together. This is a series of assessment methods planned and coordinated to achieve overall School of Medicine goals. The goal would be, in our program of assessment, that assessment for learning, or formative assessment, predominates so that our learners feel that they are receiving continuous feedback and information about where they need to go next with their learning. A program of assessment is centrally governed, meaning that the school works closely with courses and clerkships to coordinate the assessments, and that there is regular evaluation of whether the assessment program is achieving its aims and where it may need to be adjusted or improved. How does assessment promote learning? This slide shows the learning cycle. A learner has a learning experience, as shown in the top box. After each learning experience, a learner ideally receives feedback about what went well and what could be done differently. The learner should use that information to do a self-assessment to understand how that learner planned to approach that experience and what could have been done differently. Through a process of reflection, which is augmented with the support of a coach, the learner can develop a learning plan and then ideally have a next opportunity to try that same learning experience and make improvements. The types of assessment information that can inform this cycle of formative assessment are many. This slide shows how assessment methods are organized along Miller's pyramid. This pyramid is well known in medical education, and it helps educators and students to understand what information can be gained from different kinds of assessments. At the bottom of the pyramid is the knows category. Multiple choice examinations are a common way that we assess what learners know. Knows how is the next level up on the pyramid. Learners show that they know how to work through clinical problems in situations like case discussions or problem-based learning cases. Moving up the pyramid shows how is a simulation type setting where a learner interacts in an objective structured clinical exam or standardized patient exam or other simulation. We are most interested in the top of the pyramid, especially for our more senior students. This is the type of assessment that focuses on the actual workplace performance. Observations of students in the clinical workplace or multi-source feedback from interprofessional healthcare team members provide this type of information. You can see, looking at this pyramid, that at the bottom of the pyramid, where we have written examinations of medical knowledge, we have the types of assessments that typically generate reliable scores. However, at the top of the pyramid, we may lose some of that reliability, but we gain a lot in terms of authenticity by assessing our learners in the actual workplace. A robust program of assessment would have assessments from all points on this pyramid, typically more emphasis on the bottom of the pyramid early in medical school and more assessment at the top of the pyramid later in medical school. The Bridges program of assessment will have several features that help us capture these many kinds of assessment. Our student dashboard is a centralized place for all assessment data that students can access along with their faculty coaches. Bridges will focus on students' inquiry, not only what they've learned, but how they think about unknowns, how they apply and integrate information through essay exams. Bridges will emphasize competencies beyond medical knowledge, particularly in the clinical setting. The coaching program will provide an individual coach to each student to assist that student with formative assessment and learning planning. Arch weeks are assessment weeks that occur 4 times in the F1 portion of the curriculum. These are weeks that provide opportunities for students to step out of the curriculum, consolidate and integrate what they've learned, and meet with their coaches for reflection and learning planning. This slide shows a screenshot of the landing page in the medical student dashboard. You can see that the student can gain more information about their performance in different competencies, as shown in the lower left, and can also access information about reports on specific assessments, as shown in the middle. The dashboard also provides space for students to store their reflections and their learning planning, as well as to capture responses from their coaches about the learning plans that they have written. This slide shows where the Arch weeks are located in the curriculum. ARCH stands for Assessment, Reflection, Coaching, and Health. These will occur throughout the F1 portion of the curriculum. Assessments that we already have in our curriculum, like standardized patient exams and the comprehensive basic science exams, will occur during Arch weeks. We are eager for a wide variety of UCSF faculty to participate in formative and summative assessment of our students. When you are asked to evaluate students, you as a clinical faculty may be asked to use the framework of EPAs as well as competencies and milestones. All faculty should think beyond our students' medical knowledge and consider all the different aspects of competence that make a great physician. We hope that our faculty will keep assessment for learning high in their mind to provide students with continuous constructive feedback to help them achieve their goals. This completes the module about assessment in the Bridges curriculum. Thank you very much for watching. If you'd like more information about faculty development or components of the Bridges curriculum, please check out our website. Thank you.